Welcome, everyone. Thanks for tuning in to another episode of the Medcurity Podcast. Today, we're going to talk about an important aspect of healthcare compliance, the Security Risk Analysis, or SRA. Now, we talk about SRAs a lot here because at Medcurity, we provide comprehensive SRA services, so we know how important they are. We'd like to share our knowledge on what SRAs are, why they should matter to you, and how your healthcare organization can effectively conduct them to ensure compliance and protect patient data. So let's jump into a very broad overview of the security risk analysis. First off, what is an SRA? A security risk analysis is a systematic process to identify, assess, and mitigate risks to electronic protected health information. It's a fundamental requirement for healthcare organizations under HIPAA regulations and plays a crucial role in protecting patient data from potential breaches. SRAs help organizations understand their security posture and identify vulnerabilities that could be exploited by cyber threats. Now, why are these security risk analyses so crucial for healthcare? Well, with the increasing number of cyber attacks targeting healthcare organizations, conducting regular SRAs ensures that you remain compliant and minimize the risk of data breaches. SRAs enhance data security by identifying and mitigating risks early on. They improve compliance with HIPAA and other regulations, helping you avoid potential fines and penalties. They also increase organizational resilience, ensuring continuous operations even when we're faced with some of these cyber threats. And finally, SRAs are a critical way for you to be protecting the patients you serve. So while you care for these patients, you have to provide just as much care for their data. Make sure that that data isn't getting compromised. Now, why are these SRAs federally required? Well, they're mandated for a good reason. Under HIPAA, the Health Insurance Portability and Accountability Act, healthcare organizations must conduct regular SRAs to protect electronic protected health information. This requirement is grounded in data and research, highlighting the growing threats to patient information. You've probably been hearing from the news that healthcare data breaches have been on the rise, with the Department of Health and Human Services reporting over 700 major breaches in 2022 alone, impacting millions of patients. Additionally, regular SRAs help healthcare organizations stay ahead of evolving cyber threats. Cybersecurity is a rapidly changing field, and staying compliant with federal regulations ensures that organizations continually assess and improve their security posture. By conducting regular SRAs, healthcare organizations demonstrate their commitment to safeguarding patient information, building trust with patients, and ensuring compliance with federal laws. Now, let's look at some steps. How is this SRA actually conducted? Let's just look at a brief outline of how this process really works. Now, SRAs are carried out through a series of steps. First, potential threats and vulnerabilities are identified. Now, this involves mapping out all systems and processes that handle electronic protected health information anywhere that digital patient data is stored, and considering various potential sources of risk, maybe human error, technical failures, or external threats. And next, the impact and the likelihood of these risks are assessed, evaluating how likely each identified threat is to happen and the potential impact it could have on the organization, on your patients, on your ability to continue providing patient care. This helps in prioritizing which risks need to be addressed immediately. Now, after that, measures to mitigate these risks are identified. This could include updating software, enhancing security protocols, or often it means providing additional staff training. It's important to document and report these findings thoroughly. This documentation ensures compliance, provides a roadmap for continuous improvement, and is your way of being able to prove, hey, this is what we're doing to stay compliant, to keep this stuff secure, to protect the patients that we serve. Now, the future of SRAs is interesting because technology is changing fast. Tools like AI and advanced analytics can help predict and identify potential threats more accurately than we've ever seen before. Integrating SRAs into a continuous compliance framework ensures that your organization is always prepared for new challenges and new technologies. Now, by understanding and implementing effective SRAs, your organization can protect patient data and stay ahead of evolving threats. That's all I've got for today. Thank you for joining the podcast. If you have any questions or want to learn more about how we can assist your organization in fulfilling SRA requirements, feel free to reach out to us at Medcurity. Stay secure and stay informed. See you next time.